Welcome to House Calls. I'm Jessica Salazar. I'm the Director of Marketing and Public Relations here at Overland Park Regional Medical Center, a part of HCA Midwest Health. Hospitals across Kansas City are restricting visitors, including those for moms in labor. While it's not ideal, the purpose is to keep mom, baby, and hospital staff safe and most importantly, healthy. Today, we are talking with Danae Young, a maternity navigator at Overland Park Regional Medical Center, a part of HCA Midwest Health. Danae, explain your role as a maternity navigator.
Yeah. Well, hi, I'm Danae, and once again, and I'm a former labor and delivery nurse. And we started this program wanting somebody that had that background in labor and delivery to help explain to expecting parents the delivery process here at Overland Park Regional. So our main goal as a navigator is for parents to feel better prepared and ready for their big day, as it is one of the biggest days in their life. So a couple of things that we do is we meet early on and we do individualized tours, and we walk them through what the rooms are going to look like, how equipment will be used, and all the amenities that we offer here. We can also start getting them, set up for classes and kind of explain that. And then closer to their due date, we do pre-admission paperwork, and that's just a chance to talk about preferences for labor, finalize a birth plan that they maybe have created or want to create, start on the birth certificate, do baby consents, and then we can discuss pediatricians and do a health history with them. So we put all that together in a folder and get it up on labor and delivery, so that when they come in for their delivery, it's just a lot smoother process when they're getting admitted and getting everything started.
So it sounds like your role is really to help them along their journey of pregnancy.
Exactly. And they can reach out to us the entire time through their pregnancy and afterwards. One of our biggest perks that we've had is that we have cell phones and that they're able to text us on it. It has been such an awesome feature. So if a mom's at work and she's like, I don't want to forget this question later on with pregnancy brain, we all know that's a real thing. She can text it to me and then we can respond why I'm also working, why she's working. I mean, it's been really awesome. And they can, what should I pack? If they don't feel comfortable calling about it, they just want to text me. I get so many texts throughout the day, and it's awesome to just be able to respond quickly, efficiently. And, right now we're getting a lot of COVID related questions. So that just helps also just bring ease, hopefully quickly to them and make them feel more comfortable. Obviously they can still call and email if they want to, but the texting thing has been really awesome.
That accessibility is such a great patient satisfaction tool for us to have.
Yes. And I mean, we love it too. We love that they are able to just shoot us a quick text and that we can kind of talk that way.
So Danae, I know each hospital at HCA Midwest Health has different visitor restrictions for laboring moms and new moms. What is the visitor policy here at Overland Park Regional Medical Center?
Yeah. So it's kind of starting with navigation, which we would have done in person. Right now, that's changed a little bit. So we're doing everything over the phone. So patients will still call and make an appointment for labor and delivery. So they're not left, on their own with all this still. They can still make an appointment, and then we give them a call and do pre-admission over the phone. And then I can send them a tour that I've pre-recorded on my phone as well. So that way they can still kind of get a 360 view. I'm talking in the tour, giving them more information than what they would get just by looking at pictures. And then as far as like visiting going with patients, each patient gets one support person their entire stay. That person is not interchangeable. And then in addition to that, we have allowed one visitor at a time from 7 a.m. to 7 p.m. There is a age limit, and that is 12. And then so I make sure that families are coordinating with their family members or friends so that no two people are showing up at the same time, since they can only have one at a time. We are doing screening at all the entrances that are open. So, they'll get their temperature checked, have some questions asked, and then we're doing universal masking for all patients and visitors and staff as well.
Danae, what are some ways new moms are including their family in the birthing experience? Because the birthing experience has changed dramatically due to COVID-19. And I know this has kind of put a kink in some new moms' birth plans.
Yeah, it has. Honestly though, thank God we're in the century that we are, and that we can still make it really special. One of the big things that we can do is FaceTime, almost kind of like what we're doing now with Zoom. With the digital world, everyone is connected by their phone, so you can include your family in the birthing and healing process and all that by FaceTime. Obviously, photos. I believe you can create memories with every photo that you take. So I'm a huge photo taker. So you can send those obviously via text, email, you name it. Another big thing that we've been seeing is a lot of families are ordering in meals for their loved ones here that are delivering. So I see a lot of pizza boxes that are being made, brought through the hall, stuff like that. If now that a visitor can come in, they can bring that food with them for the expecting parents. Or if there's already a visitor here, they can still send it and the spouse can come down or the support person and grab it from the ER entrance and then, bring it back up. It's kind of like a celebratory meal from their loved ones saying, hey, we're still with you. We love you. We're sending you guys some food. We know nobody wants to be hangry. So that's been a big one. And then videos. We see a lot of this even before the pandemic happened. During delivery, we have a lot of family members that pull out their phones and videotape stuff, like the bath, their very first bath. Why wouldn't you? That's awesome. Getting their first weight done, anything like that. They are allowed to take those videos and share them with their family and friends. And then we've also, something that's been really cool, and I actually got to witness this. We have had families stand out in our parking lots, and the expecting parents are looking out the window, and the families all get together, obviously social distancing with their masks on, but they have huge signs that they've created just to share that love with their, the parents and say, we're here for you, we're excited. So that's been a really cool one to kind of watch. And then we also created this little born in a pandemic card that they can fill out. So it obviously has stuff about baby on it, but then if you turn it over, it also has like the price of gas right now and toilet paper. I don't think anybody's going to forget what it's like to deliver in a pandemic, but it's always nice to have a little keepsake to look back in like 20 years and say, oh my gosh, I was born here and this is what my parents filled out, and just kind of, look at the differences of what it was like 20 years ago when they're older. And then of course we have our NICU. So if babies are in the NICU, one of the things that they can do is we have camera access that, the parents can send out to their families, and then they get to look at the babies that are in the NICU. We also are allowing both parents to be at the bedside in the NICU, which is something we weren't for a while doing. So that's something that has changed too.
So families are still able to stay connected during the birthing experience, even though they're not present here at the hospital.
Absolutely. It's I think even more so now, because we do have this thing where we can send a video to everybody. So, and of course people really want to be there for their loved ones that are going through this uncertain time and they never delivered a baby. So people are really reaching out and saying, hey, however we can help. They're sending videos to the parents saying, we just love you. You're going to get through this, giving them encouragement through videos or photos. Like it's been really cool and fun to watch.
So Danae, our expectant parents can now take our HCA Midwest Health Healthy Arrivals classes from the comfort of their own home. Can you explain what that looks like?
Yes. Classes are obviously just another step to make parents feel more comfortable and confident for delivery. So we offer online classes for their convenience, like you said, from their home. And another thing is they can also take them at their pace. So that's kind of what's nice too. If you have a busy day and you just got to finish it a little later on, that's great. So take it at your pace. We have a couple classes that we're offering doing that. It's the Baby Basics 101, breastfeeding class online, and then childbirth preparation. And then another thing is we're doing live videos via Zoom. So those 3 classes that I just mentioned are offered, but we're also doing low intervention as well, which is a really great class.
So families can still prepare for childbirth just in the comfort of their own home. They're not actually having to come to the hospital to take those classes.
Yes, 100%. And right now the classes are free. So they can go to healthyarrivals.org and sign up, or call 913-541-5999. And Mary, who's in charge of classes, will help get them set up.
Awesome. So Danae, what are new families telling you about their birth experience during the pandemic? I know you've received some emails and texts from families who wanted to share their experience.
Yes. Yeah, that's been really fun to hear too. I'll read you a couple. I wanted to send a note that possibly could be passed on to your healthcare team to let them know how much my husband and I appreciate all the care for us during our time at Overland Park Regional. All of them were amazing, and we truly had a great birth experience despite COVID. I'd like to especially thank our night nurse who helped me to stay my course of a natural birth when I didn't think I could do it. She was a great encouragement to me, and I'm very grateful. Really, every nurse and caregiver we had the pleasure of interacting with were incredible. We are truly grateful for each of them. So that was one. That was really, I mean, that gives me chills just reading it. And then another one was everything went great. The delivery went smoothly. Everyone from the anesthesiologist to the delivery and post-delivery nurses were incredible. Everyone was so professional and passionate about their work, all while having a good time and enjoying what they do. My husband and I were beyond pleased, and our expectations were met plus more. And then I also want to give a shout out to my partner, Lisa Hulk. She also got recognized for making a patient feel very comfortable during the COVID emergency while doing her maternity navigation appointment. So I just want to recognize her too.
So these are great testaments, not only to the nurses here at Overland Park Regional Medical Center, but all throughout HCA Midwest Health, who are really working with families to make this birthing experience just as best as possible.
Yeah, you got it. Yep.
Danae, thanks for your time.
Yes.
We answer more of your questions about pregnancy, delivery, and postpartum care on our COVID-19 Pregnancy Resource Hub at oprmc.com.